evening guys. So welcome to this YouTube session from Unacademy. So this will be a special session that we are taking as to the preparation of NEET PG. A small session for 30 minutes, that is what we are going to take. Okay. So if I am properly visible and audible guys, give me a thumbs up and then I'll start. I would like to be an interactive session. That's how I like it to be. Okay. So I'm just waiting for your responses. Okay, so let me just begin the session by introducing myself to you, and then we'll start with the way that we have planned this session for. A small 30-minute session is what we are going to take. My name is Dr. Vinish Srivastava. I'm the head of the department and senior consultant in anesthesia and critical care. Presently, I'm working with the Fortis Lafarm Hospital in New Delhi. Before that, I was working here itself as a senior consultant for the last 8 years. Before that, I was at Maulana Azad Medical College. I've done my senior residency from Maulana Azad Medical College and I was also a specialist over there. Before that, I've done my DNB secondary anesthesia, that is from Deen Dayal Upadhyay Government Hospital, New Delhi. Before that, I was in Mumbai, Grant Medical College, Sir JJ Group of Hospitals. I've done my DA and FCPS from Grant Medical College, Mumbai. Before that, I was at Lokmanya Tilak Municipal Medical College, Sion Hospital. I've done my respiratory medicine from there. Before that, I've done my hospital administration. And before that, MBBS. There was a slight introduction about myself. So, this is me giving spinal COVID duties. All of us have to be careful. So, I like my work. Alright. And I think all of you like it and want to look forward for your PG seat. Alright. Apart from the clinical practice that I'm doing, I also like to play a guitar. That's a hobby that I have. Here I'm playing with a band, a local folk band. Apart from all these things, I've also been teaching students preparing for postgraduate medical entrance exams and FMGE exams for the last 10 years. Okay. What keeps us back into studying or teaching every time is because of the dedications and the followers. I mean, these are new things to us, but at Unacademy, this is what makes us realize as to the number of students who are around. Alright. Every time when we take a class, it's always about discussing about concepts. Alright. So discussing concepts, and that's how these are few. This is about the INI CET recently, which was held, and I would like to thank all the students who got in contact with me and finally said all the questions basically come from the discussions. Correct, because if your concepts are clear, then all the questions will definitely be coming from the discussion that we are taking. Alright, so most of the questions are definitely going to be from the concepts. Once your concepts are clear, all the questions become clear on their own, guys. Okay, and that is what everyone tries to do. And I thank all of them who have given me all these feedback, makes us feel good and gets us back to teaching again and again. So we target the concepts, try to teach them in a simplified manner, and all of us have said, and thank you for all these dedications and feedback, guys. Okay. As I said, we are always, these are the things for the month of, that was for the month of October and November. These are the ones that, you know, for the classes that we took in the month of September. I'm just trying to just show a few things on to you. And ultimately, the whole point is to decide about the concept. So not just in anesthesia, any subject that you're studying, guys, it's always try to clear the concepts and things would become much more easy. So all the teachers, wherever, whichever branch they are teaching, everyone will try to take care of the concepts, and that's what the feedback has been given by each and every student who have been attending. Okay. So thank you students for all the feedback that we've been given for all this while. Okay. So now, today's session, guys, all of us know that the NEET PGs got postponed. Alright, so we have almost 3 months time. A big question, I'm also available, let me tell you, I'm there on the Unacademy platform. Alright, so we are there on the Telegram links also. You can follow us at the Telegram links, it's all given below. Okay, so we have our NEET PG Telegram platform. Apart from that, you can contact me directly at t.me Dr. Vinish. It's not a group, it's a direct contact to me. Alright, so this is my Telegram ID, guys, Dr. Vinish. DRVINIS. There's no one else with that name. You can just search. You can just search in the Telegram. Alright, in the search column, and you can just type Dr. Vinish, and that would lead to me. any questions or doubts, I'll be there to solve your queries to the best of the ability that I have, okay, to the best way that I can. So a lot of people got in contact with me on Telegram. A lot of students told me, sir, we want to know as to the exams have got postponed, what to do about anesthesia. Everyone was prepared that the examination is going to be held in the month of January. Alright, so then now thinking that it's got postponed again, so you have December also with you, you have Jan also with you, you have February also with you, and you were kind of almost prepared going on for the last revision. So everyone's doubt was how to go about anesthesia and other subjects. So all the teachers in different branches are trying to tell you about their branches. Let me talk about anesthesia as what you should be doing in terms of the next 3 months. Okay. So any questions or doubts, guys, I'll be glad to take it up. So let me know if there are any questions. Okay. So now what is there is that we have 3 months with us. Okay. So I'd also like to tell you what are the important topics over here where you'd want you to concentrate upon. So a lot of people say that, you study anesthesia for 2 weeks, 3 weeks. I feel no. So therefore let's divide. If there are 3 months, now again you have about 3 months where you can Dr. Keshav, not an issue, Dr. Keshav, all fine, don't worry. Okay, so there are a lot of students who attend the live classes that we are having on Unacademy. So Dr. Keshav has a doubt that they're aap kisko padha rahe hain. Nice. See, the point is a lot of students are there on the Unacademy platform who normally attend the classes, guys. So therefore what happens is our videos are recorded. Alright, so the point is the students have asked me how to prepare for the next 3 months. I'm just going to try to give a feedback to them as to how they can go ahead with that. Alright, now these sessions on Unacademy, we have our special classes, the plus classes, and these YouTube sessions. These YouTube sessions, Dr. Keshav, they get recorded, okay? So what happens is all the students who have asked me as to how to go about it, instead of wasting their time on taking a special class or a plus class on the Unacademy platform, I'm trying to take a YouTube session to them and trying to clear the doubts. So all of them will come, afterwards, and they can just go through these videos again, and they give us a feedback also. Okay, so the whole point was to discuss about them because December, next month is December, right? Today is 30th November. So we have December, we have January, and we have February. So what's the timeline and how to go about anesthesia is what we are going to discuss in the small session that we are having. Okay, it's a very small session, not a big session at all. But the whole point was how to go about anesthesia. Right, Dr. Keshav? Okay, so everyone has a doubt regarding this. Alright, so everyone feels that it's going to be easy, but then to divide the time, it's not easy, guys. It's not easy that way. Okay. My pen wasn't working, so I kind of logged off all of a sudden. There we go. Alright, there we go. So, as I was discussing, let me go forward. This is all we've already finished. Let me just go ahead to the session that we were taking. Alright, so Jan, December, Jan, February. This is the time that we have. So a lot of people do say that please study anesthesia for 2 weeks. I feel right now when you guys are already prepared, 2 weeks presently to divide among 19 subjects. Alright, you have 3 months with you. There are 19 subjects which you are left to study. Don't try to give 2 weeks, it becomes too much. So in the month of December, what I tell you is try to study anesthesia for about 4 days at the maximum, not even 7 days. So 2 weeks is almost 14 days. You don't need 14 days to study anesthesia. Remember guys, this is a revision. What we plan is first study, okay, anyways this is going to be a revision for you, then a second study in between so that you just revise the important concepts, and then there is a third study which is just 1 week before the exam. So divided into 2 parts. Alright, the initial thing is in the month of December, a second one small time to be taken in the month of January, and the last thing is just 1 week before the exam. Alright, this is towards the end of Jan. I'm just giving you the timeline for anesthesia as how you should be going regarding anesthesia. Okay, so in the month of December, I feel try to give 4 days to anesthesia, whichever is there. I mean 3 to 4 days. Forget 4 days also. 3 to 4 days is sufficient because I expect you people to have already read about it. In January, maybe give about a day or two. All right, sufficient. You don't need to give more than 2 days at all. And last I would like to give you is about 6 hours when you revise it completely. All right, so this was the doubt that everyone had, that we have 3 months more now, and in these 3 months how do we divide time for anesthesia? Because a lot of people said, oh, you've got a complete time, so might as well study and finish off anesthesia in 2 weeks. I feel that would not be appropriate. According to me, just because this is going to be a revision for you, you people have already studied and were prepared for NEET PG. So therefore, give 3 to 4 days in the month of December. Divide your topics. In the month of January, it's going to be again a revision. So you give 1 or 2 days at the max. Alright. And the third study, what I will say, is 6 hours 1 week before the exam. Just 1 week before the exam. Okay. So this is the timeline that I think, which is sort of revision first, revision second, and revision third. Alright. Apart from that, there are also questions regarding what topics to concentrate upon and where to pay more attention to. So therefore, now coming to that question. Alright, so when you come to the topics, so then now that we have decided about the timeline as to how to go about it, so we'll divide anesthesia into various parts. Alright, there can be parts related to PAC, there will be parts related to general anesthesia, there will be parts related to anesthesia machine, okay, there will be parts related to local anesthesia, there will be parts related to regional anesthesia, okay, and then finally you will have other drugs in anesthesia. There might be CPR and some miscellaneous topics. If I broadly divide anesthesia, okay, broadly if I divide anesthesia into various things, this is how it gets divided out. Okay, so pre-AC is pre-anesthetic checkup. This will form, you know, the bulk of questions, as in if the patient is coming, what is about the ASA grade of the patient, a question comes from there. It comes about the airway examination. Alright, so questions about airway examination come from here. Apart from airway examination, ASA grading, you will have questions related to the pre-medication, alright, what is to be given, and the medication advice, as in which medication is to be stopped and which medication is supposed to be continued before the surgery. So if someone tells me on the PAC, guys, pre-medication and medication advice is easy, you don't have to study quite a lot, just have to read it once, you don't have to understand any concept behind it. But ASA grading and airway examination become important. Okay, here there are concepts which you need to be clear. So if someone tells me in PAC sort of thing, where should I pay more attention to? I will say kindly go through the ASA grading and airway examination, because airway examination is where you get that Malam Patti grading. It itself comes as a different question, image based question also can come from there. Then you have various situations which can be difficult airway. So the question comes from there. Okay, so difficult airway. So therefore these two parts in the PAC become the most important according to me. Alright, pre-anesthetic checkup. Of course there are questions come on pre-medications, but remember pre-medication drugs become a sort of pharmac also, na? So you will be studying them in pharmac, it overlaps. Medication advice, yes, it's there in anesthesia, but lot of it you might study in surgery. Okay, and of course these are pharmac drugs. So guys, this is already going to get covered in pharmac. So therefore, of course, you will be knowing it. If you have ample time with you, you can go through it. But when the time is less, concentrate on the anesthesia topics where you expect more questions to be coming, or where your concepts become more important, which is the ASA grading and difficult airway or airway examination. Okay, that's the first part. Then going to general anesthesia, guys. So general anesthesia by itself is a huge topic when you put someone to sleep. So general anesthesia, you will have all the inhalational drugs. Okay, you have all the intravenous drugs. Now intravenous drugs can be intravenous induction agents. There will be muscle relaxants. Okay, alright, and there will be opioids. Again, here what to do. So guys, opioids is a group of drug, again covered totally in pharmac. You study day in and day out about pharmac. Alright, so therefore opioids, kindly if someone says, you can, you know, reduce the time that you want to give to opioids because it overlaps with pharmac. Alright, so this becomes less. So what topics are then left which are important to anesthesia and related to anesthesia? Again, inhalational and IV induction agents. So when you talk of inhalational, guys, there will be old agents and the newer agents. So in the old agents, you will have nitrous oxide, you will have ether, you will have trilene, you will have methoxyflurane, okay, chloroform, cyclopropane, alright. But the point is, all these old agents, normally they won't ask you a question apart from nitrous oxide. So what becomes most important here is nitrous oxide, where you should be knowing it properly. So when you're getting the time and you want to revise, don't waste a lot of time on ether, trilene, methoxyflurane, cyclopropane, alright, and other drugs, alright. Newer agents, all of them become important, whether it is halothane, sevoflurane, isoflurane, desflurane. All the four become important. Questions are asked on each of them, alright, and different times. I mean, last 2 times I remember questions coming from desflurane and halothane. Definitely it has been asked. Okay, so one question, guys, normally always comes from an inhalational agent. You already know that. So even one point, one question become important. The difference between the seat that you score in your PG can be based on one question also. So therefore, if you already know that inhalational, there will be a question. Normally it always comes, whether it is nitrous or the newer agents. Concentrate on that and finish that topic out. Okay, so this is about the inhalational agents, and concentrate on nitrous, halothane, sevoflurane, isoflurane, and desflurane. When you talk of the IV induction agents, guys, IV induction agents, here you will have thiopentone, propofol, ketamine, etomidate. Alright. Some books and some people also mention or like to add benzodiazepines to it, which is midazolam. But guys, midazolam again forms as a drug common to pharmac, common in medicine, common in psychiatry, common in pharmacology. Therefore, even if you study benzodiazepines less or pay less attention to them in anesthesia, it's kind of understood. It's okay, because you'll be covering a lot of it in pharmac. Therefore, when you talk about anesthesia point of view, then thiopentone, propofol, ketamine, and etomidate become very important. So therefore, do you realize, guys, what we are doing is trying to shorten out our way of studying. Instead of paying attention to the whole subject, what we are doing is trying to formulate a plan where we try to study the topics on which the questions are likely based, or the important ones which are related to anesthesia. So which was our ASA grading that we just saw, the airway examination, the old drugs, nitrous oxide, newer drugs, inhalational agents, and IV induction agents like thiopentone, propofol, ketamine, and etomidate. Okay, any doubts, anyone? Dr. Keshav, you there? So anyone? Okay, so let me go forward. Alright, if there are any questions for anyone who's around, you can just ask me a question, guys. Alright, and I'd like to clear them to the best that I can. Okay, so now that we have discussed about the inhalational and the IV drugs, guys, what is another important topic is muscle relaxants. As I said, inhalational and IV में से questions आता है, साथ में muscle relaxants से भी question आता है. Muscle relaxants are those drugs which are neuromuscular blocker. Okay, these are neuromuscular blocking agents, and here you have drugs like succinylcholine, which is depolarizing. Remember, succinylcholine is the only depolarizing drug that they ask in exam. And non-depolarizing, you'll have all of them: pancuronium, vecuronium, rocuronium, atracurium, cisatracurium. Okay, so all these huge group of drugs. But the point is, when you study neuromuscular blockers, here just one point is important. You don't have to read everything. So like in pancuronium, all of you are aware, the most important property would be related to that heart rate. Okay, increase in heart rate, increase in BP. If you go to vecuronium, the important point would be it's the most cardiostable and the most common agent used. Okay, you go to rocuronium, you would know it's a very painful injection. It's a fast acting drug. Alright, so these 1, 2 points are only important. You don't have to get into pancuronium and keep on studying it for 10-20 minutes. 1, 2 points is sufficient for these drugs. As in atracurium, even if I say atracurium, half your people will start thinking, correct, it is Hoffman's elimination. Now, what I'm discussing, guys, here is true not just for your NEET PG. Even people preparing for FMGE can follow up the same guidelines here. It's the same thing. Okay, it's the same thing for people preparing for FMGE exams also. Alright, as the whole point was where to concentrate, which topics are important, and how to go about it. So now that we have discussed about the GA part, and I told you inhalational is also important, IV and muscle relaxants. Opioids, you can be a little bit relaxed, and I also told you about benzodiazepines, you can be a little bit relaxed till here. Okay, so any questions or doubt till here, guys? No one? ठीक है, कोई डाउट होगा तो मेरे को पूछ लो. I'll try to solve them. So let me just go forward and then discuss with the next part. Okay. So monitoring again becomes an important part. Before I go to anesthesia machine, guys, just remember monitoring has been a recent question. So once we discuss the anesthesia drugs, guys, then I told you have to study about the anesthesia machine. Anesthesia machine becomes very important. So in the anesthesia machine, when you talk about cylinders, when you talk of cylinders, the color and the pin index are absolutely important to know. Okay, every second, third year they'll ask you. Nowadays questions are even come on pipelines. Alright, so anesthesia machine, cylinder, pipelines become important, especially the color. Last 2-3 times they've been asking just this color coding. What is oxygen, what is nitrous? In fact, guys, INI CET, all of you have given, already know that nitrous oxide question was asked color blue. All of you would be knowing that. Okay? So this is an important thing. They've been asking this question for quite some time now based on cylinders and pipeline. Point is, concept should be clear, you'll get the answers. Apart from that, anesthesia machine, breathing circuits are important. Okay? So in breathing circuits, you are supposed to know about the open circuit, the Mapleson circuit, the closed circuit. Okay, so Mapleson circuits and closed circuits become important. You need to know about them. And then you go to monitoring. Monitoring again becomes an important part. Alright, and then when you talk about monitoring, especially bispectral index has been asked many a times in the recent times. Okay, so bispectral index, which monitors depth of anesthesia, has become important. Capnography. Okay, end tidal carbon dioxide. This is also very important. Capnography. There are graphs on capnography which are asked as image based questions also. So capnography, bispectral index are important. When you talk of things like heart rate, BP, all this is already covered in medicine. It's already covered in physiology. So don't think too much about it in terms of anesthesia. In anesthesia, concentrate on those monitors which are specific to anesthesia. So EtCO2, bispectral index. I would also like to add now, in terms of COVID, pulse oximeter has become so important. Every home has a pulse oximeter. People who are turning COVID positive, the government is sending pulse oximeter to their houses. I hope you are all aware of that. So therefore, pulse oximeter becomes an important monitor. So please pay attention to that. Okay, guys? Alright. So anesthesia machine, breathing circuits, monitoring. So 3 things we have discussed after the GA. Alright. Okay, so I hope you are aware, guys. We also have our iconic subscription, okay, where we have Unacademy, which is there together with Prep Ladder. Okay, it includes both best of both the worlds. They are both combined together, Unacademy with the Prep Ladder. Unacademy is like the classes that we take right now. Presently, I am on YouTube, right? At 8 o'clock, 8 PM today, I'll be there in special class. The special class is supposed to be free. And after that, we also have the plus courses. So there are various things which we have. As of now, I'm taking this YouTube session. Again, straight away at 8 o'clock, I'll be going for a special class where I have a discussion on MCQs, which I'm continuing it. Now, this is for FMG students. Alright. So now, the point is that these classes, all that you see, are totally free. Alright. They're totally free. All you need to do is download the app and just join them. And you can see, of course, YouTube is totally free. Special classes are totally free. Alright, so you can just decide as to what is the kind of thing that you want to go to. So, iconic subscription includes a complete thing of Unacademy and Prep Ladder. You can get further information. You can follow us on Telegram as well as Instagram. I've given you my Telegram ID also. It's Dr. Vinish. Any questions, any doubts, I'll try to help you to the best of my ability. Okay, talking about the iconic subscription, guys. So what we do is, as in Unacademy, you're getting the live classes and the batch courses. There are the tests which keep on happening. I finished a complete 5-hour test course yesterday. Okay, so it was almost 5 hours of intensive test plus discussion based on that. This is what we used to call as TND, test and discussion. Alright, for anesthesia. Lots of live quizzes keep on happening. Apart from that, when you take the Prep Ladder, you've got the video lectures and question bank and the repeat revision courses. Okay, guys, so this is how you go about it, selecting the kind of subscription that you want, whether it's iconic or just the plus that you want to go to. Okay, for me, what I would say is the best thing is an iconic where you get both the things here. Apart from that, don't worry, there are a lot of free things that keep on happening. This is one of them. I hope you are aware that every day at 8 PM, we are having a daily T20. What is this T20? Just like the cricket match, a set of 20 questions. Okay, all of us contribute to the number of 20 questions per day. All you can do is keep on answering them and see where you stand. It tests your own knowledge. So it's absolutely free. You just have to download the app and appear in the test. Every day there are 20 questions at 8 p.m. And now for people who are appearing for NEET PG 2022, who will be going for perhaps those next exam, that is again at 9 p.m. we have questions, again 20 questions, 9 p.m. at that point. Okay, so try, attend the live test and you can see how it goes for you. What you need to do is just download the app and you can proceed forward for that. Alright, so you can go ahead with that point. Coming back to our discussion that we were having. So I had discussed about the PAC part, I discussed about the GA, I discussed about the anesthesia machine. Alright, after that, what was left out was to discuss about the local anesthesia. So remember guys, local anesthesia itself has a set of drugs. There are drugs lignocaine, you have bupivacaine, you have ropivacaine. Now, these drugs become specific to anesthesia guys. And normally of course they are given in pharmac as well. But you don't discuss them so much because local anesthesia forms more of a part of anesthesia. Therefore, I always say pay attention to local anesthesia. You don't study benzodiazepine, it's okay. It will get covered in some part. But lignocaine, bupivacaine, ropivacaine has to be studied properly from anesthesia. The same drugs are used to give regional anesthesia also. So when you start studying spinal, you start studying epidural, you start studying blocks. So this part become important guys because the same drugs are used to give that. So therefore, please concentrate and this topic has to be done properly from anesthesia point of view. It does not get repeated in any other branch like when we were discussing about drugs like opioids and we were discussing about benzodiazepine. So these two drugs that you will see are discussed more in many other branches. Okay, it's a common between many branches, it becomes okay. But when you talk of local anesthesia and regional anesthesia, they do not get discussed in other branches. So therefore, please concentrate. Concentrate on anesthesia to get that topic done. So now when you're dividing your time, you know where to concentrate in PAC, alright, in GA, the kind of drugs, anesthesia machine, breathing circuits and monitors. Dr. Megha Singh has a question. How much anesthesia important for final prof? See Dr. Megha, there are two ways to look at it. So that's a good question. That's why I'm answering that as well. So it depends as to how many questions you're expecting. As of now, when there are 300 questions coming in an exam, the amount of questions that come from anesthesia are 6 to 8 directly, plus another 6 that come in form of CPR, that come in form of ventilator, which are common to critical care, and you will have IV fluids which overlap with pharmac. Alright, so therefore normally books mention that there are 6 to 8 questions, but I do realize that when you see the questions, there are almost 10 to 12 questions that come from anesthesia. When you give a final professional exam, normally the anesthesia's question is included in the surgery part itself. Okay, so if you are a final MBBS student, the anesthesia question related to especially local anesthesia, spinal or epidural, or the type of anesthesia forms as a part of surgery. So when you appear in a surgery paper, they will perhaps give you 2 or 3 small questions related to anesthesia. More important, anesthesia rather than appearing for a final prof comes out in terms of when you're giving your entrance exams. So therefore, all these short subjects, whether you take skin, anesthesia, radiology, psychiatry, orthopedics, ENT, alright, opthal. Dr. Banzul Tank has a question. Exact values of MAC of each agent. Dr. Banzul, I'll say don't. If you have to study so much to remember this much, don't do it. Okay, but you need to remember how they are related to each other. For example, all the old drugs that you will see, ether, methoxyflurane, and these drugs which are not used. Okay, so yes, anyways they are not being used. Halothane not being used because they must have a reason. So these drugs have more complications. You don't use them. Their MAC is very low. Okay, so that means they are very potent agents. You normally don't use them. We use agents such as sevoflurane, isoflurane, desflurane, and nitrous oxide. These are not very potent, means not very strong agents, but we use them. So kind of remember this part. Yeah, Dr. Banzul, I hope you get that point. Dr. Megha, I hope I've cleared your point also. Alright, so remember Dr. Megha, as I was saying, when you're appearing for your PG entrance, it's the short subjects which become important, because in the long subjects, for example, when you're studying medicine, it's not very easy to finish off Harrison. Okay, but short subjects, it becomes much more easy. Alright, so that's why that becomes important. So now, any other doubt, guys? Anyone? I hope I've cleared. If there's something on your mind, ask me. Alright, so this is Dr. Megha. Dr. Megha says, sir, we don't even have anesthesia books. And it's not that important, don't worry. Whatever is asked in the exam is covered in Pharmac. Okay, our teacher will not pay special attention, that's okay. Dr. Harika says, hi, for a daycare surgery, which is best? Desflurane. Desflurane, na? Fast acting. Dr. Harika, it's Desflurane. So, let me just tell you. So, guys, you can just follow us on Telegram here. The Telegram, Instagram. And I also told you, please note down my Telegram ID. It is Dr. Vinish. If there is any question, just search me on Telegram. Okay? Search on Telegram and you will come to Dr. Vinish. It's not a channel. You can ask me a direct question and I'll try to help you to the best way that I can. Okay? Directly search for me at Dr. Vinish. Okay, Dr. Harika, Dr. Megha. And Dr. Megha, whatever I'm discussing are the best topics. In fact, that's how to go. If you see the whole session of YouTube that I've discussed today, it's about the same thing, which are important topics from anesthesia. And you can read it from anywhere. There's no special textbook you want to go through. Okay, it's all available on the net also. It's like a time pass you can study. Okay, so I was just trying to tell you, we have our intensive batch for 20 revision batch going on, and I will be starting on 14th, 15th and 16th. So guys, all you can do is just download the Unacademy app. And you can go through all our YouTube sessions and the special classes which are totally free here. You don't have to do anything. In fact, today also at 8 PM, I am having a special class for FMGE students where I am discussing MCQs. Okay, so all you people can join me there itself. Okay, Dr. Megha, Dr. Harika, just download the app. Okay, and it's a totally free session even today. Even today at 8 PM, I am taking MCQs. Okay, I'm going to discuss it for the FMGE students who are preparing. So I'll be discussing about 8 to 10 MCQs and the concepts behind that. Right? So Dr. Megha, Dr. Harika, you can join us there itself. It's a completely free session. You don't have to do anything for that. Alright. So apart from that, Dr. Megha, do we get Viva? No, there will be no Viva for you. It's only in the end, exam that you will write 1 or 2 questions. Alright. So this was about the intensive care batch. Alright. Which you're going to do 14, 15 and 16. Dr. Megha says no clinical exposure, not needed. It's okay. Don't have to worry about it. Just read the theory. Once you get into PG, you'll be doing whole life of clinical exposure. So guys, let me finish off on the topics that I was discussing. I discussed about the PAC, important ones. I discussed about general anesthesia. Then I discussed about the anesthesia machine, and I told you to pay special thing to monitoring. I told you pulse oximeters become very important because of COVID. So questions come from there. Then I discussed local anesthesia. I discussed about regional anesthesia, spinal, epidural that are important. Then guys, other topics in anesthesia, especially critical care become important. Some questions come from that, especially related to ventilators and central lines. Alright, and CPR forms the backbone. CPR always 1 or 2 questions come from anesthesia. Alright, CPR as to how you'll approach the patient, how you'll go about it. This becomes important. Last was a miscellaneous topic. Miscellaneous is guys questions coming from specialty branches like laparoscopy patient going under anesthesia. Alright, or some ENT patient undergoing some anesthesia, something special over there. So these questions are less. So all the students who had asked me on Telegram as to how to go about the next 3 months for studying because the NEET PG exams are postponed, I gave you a slight idea as to how to study. I told you to again the same thing, because you people are doing revision, study for 3 to 4 days in the month of December. In the month of January guys, give 1 or 2 days at the max to study anesthesia. Just 1 week before the exam, give 2 to 4 hours. That's it to study anesthesia. Apart from that, you don't need to do anything more because this is a revision thing. Also, I told you that please pay attention to the important topics. I gave you the topics from PAC, GA, anesthesia machine, local, regional, and I told you where to pay your focus on. Okay guys, any questions, doubts? Dr. Megha, Dr. Harika, Dr. Benzul. I'm sorry if I'm not pronouncing your name correctly. Now, this is another complete course which I'm starting. This is going to be in the month of December. This is basically targeting 2022. I'll be taking classes and trying to finish off the complete anesthesia. This is on the Unacademy classes. So Dr. Megha says your special classes are available on Unacademy. Dr. Megha, you'll have to go through them. Okay, absolutely correct. There are lots of special classes available. Please go through them. You'll realize it. Over the last 3 days, every day at 8 PM, I've been taking classes for FMG students. There have been almost 8 to 10 MCQs I've been discussing. Alright, so you can go through the special classes and see what you like. Alright, there are lots of classes on special for from my side also. Okay, absolutely we are there. Okay, so it just depends. See, the point is in a special class we don't get so many hours. That's why we have to go for the plus class where we take almost lot of hours to teach the same topic. In the special we try to target with the MCQs and have a good discussion based on MCQs. Yeah, Dr. Megha. So all you can do is you can just download the app. Download the app. Just go to the special class if you're keen a little bit, today itself I told you at 8 p.m. I'm taking class for FMGE. This is the third session today that I'm taking for FMGE, where I'm going to discuss MCQs, and apart from that, discussion based on that. Okay, so you can go through it for yourself. Whichever subject you find is your lacking, pay attention to that. Alright, so Dr. Megha, I hope your doubts are cleared. I'll see you at 8 then. Alright, guys, I'll see you at 8. Dr. Harika, Dr. Megha, I'll see you all at 8 o'clock. So that's small introduction about myself, and I told you I'm available at Telegram, Dr. Vinish, and I'll try to solve anything to the best of my ability. Okay. So thank you everyone for joining me in this small session. This session was basically for people, all of them who had asked me as to how to go about for the next 3 months and which topics are important to prepare from anesthesia. Okay, this small topic was, the discussion was based on that. Okay, so thank you everyone for joining, and you can go through all the sessions that are available on YouTube. They are totally free. You can go through all the special classes that are totally free on the Unacademy app. Okay, it just depends as to what suits, which is your subject lacking. You can pay attention, you can go through them. Alright, there's so many educators, you can go through all of them. I'm the one who teaches anesthesia. Other people are also there. So everyone has their own way of teaching. I teach anesthesia. Okay guys, so thank you for joining me on this session. Alright, so I've given you all the Telegram links. There are Instagram links also. Any questions or doubts you can ask me. Okay. So thank you Dr. Megha, Dr. Harika, Dr. Keshav, Dr. Banzul. Alright, so thank you guys. Okay, so I'll catch other people, catch you at 8 o'clock. Alright, at the Unacademy app, special app. Okay, so bye bye, take care.